We're going to be reviewing the uses and ways Botox can benefit you for TMD, TMJ problems, tension headaches and migraines, a gummy smile, and have you ever heard of a lip flip? When I bring up Botox to patients for the first time, they're typically afraid I'm going to make them look like this. You know, the frozen face. Don't worry, that won't happen. Botox can be an incredibly valuable and beneficial therapy if you're a candidate. First, a quick review of how it works. Put simply, Botox is an acetylcholine release inhibitor and What the hell did you just say? What it means is it essentially reduces the intensity and the strength of muscle contractions. It, in a sense, relaxes the muscles, almost paralyzes them. Now, I know that sounds kind of freaky, but the muscles at their core are still fine. It just kind of interferes with the communication with them, which then reduces their activity. When it comes to Botox and dentistry, the number one thing that we use it for is TMD and TMJ. That's another way of saying basically jaw pain or jaw problems. Mainly Bruxism, clenching, grinding, even lockjaw as far as kind of like the normal function and movement of the jaw. So in these patients, typically the muscles are active, very active, a little too active, which can result over time in that masseter hypertrophy, as far as like kind of that enlarged cheeks. And of course, also pain within the muscles and even the jaw area. So one of the objectives here is to basically get the muscles that are affecting the jaw to settle down a little bit. And that's why we use Botox. When it's used for this case, it can help reduce the muscle activity, the amount that you actually are clenching and grinding, the amount of force that you're exerting on all the other structures, your teeth, your jaw joint, and things like that when you are clenching and grinding, which should alleviate some pain and the tightness of the whole system. And of course, the other enhancement is the injections in this area can have kind of that slimming effect on the mandible that a lot of people seem to love. Now, the most common area that we inject for TMD, TMJ problems is the masseter, this muscle right here, when you bite down and it bulges out. We typically treat both sides in the most painful areas if we can. Now, there are certain zones that we want to stay within to avoid complications. And then in some patients, we also, in addition, will inject into the temporalis area. You know, if you bite down, you can kind of feel that bulge out here too. So for the TMD, TMJ, the masseter, and sometimes the temporalis. If you've had Botox before, these injections may not seem like a big deal. Now, if you've never had it, it might seem a little spooky to think about getting those injections in those sites, but I can promise you it's actually a very quick and easy procedure. And the majority of patients that we do them on really experience minimal discomfort. Of course, it could be uncomfortable. You could get a little sting here or there, but it's usually very quick and it's not too uncomfortable for patients. Now, the amount that we inject and the frequency and the timing that we do that will vary between patients. So I have some patients at our practice that, we will only do it one time a year and that seems to get the job done. I have others who will do it twice a year and that's what works for them. Others who need it really, it seems every 3 to 4 months. Now, I'm not trying to sell anything here, but I can tell you from all the patients that I've done this on, the majority, if not probably 90%, continue to do it because they experience so much kind of relief and benefit from it. This next point I think is very important. Botox can be very helpful for TMD, for TMJ problems, but in my opinion, I feel it is best when combined and used with other therapies and treatments such as like a night guard or an occlusal orthotic. Yes, it's nice to reduce the muscle activity and that will get you relief, but we also want to protect the teeth. We also want to protect your jaw joint. And in a perfect world, reduce the number of times that you have to continue to get the Botox over time. The second most popular thing are tension headaches and migraines. So Botox has been shown to reduce the frequency and the severity of headaches and migraines in patients and lead to an overall increase in the quality of life. So some of the team at our office, who are patients at our office, with our posture and how we work during the day, have a lot of like muscle tension. And I can tell you the Botox really helps with this. So I think one thing that is really important with this is to have the right expectations going into it. I tell patients it's very important to have the right expectations when it comes to treating the headaches and the migraines. Botox is not a magic wand that we kind of wave and it will get rid of everything completely. It's meant to reduce the severity and reduce the frequency. And the results will vary between individuals. When doing a Botox for headaches and migraines, here are the areas that we typically treat. We treat the frontalis, so the forehead area, which patients really like because, of course, everyone wants to get rid of the forehead wrinkles. We also will treat the glabella area, which is basically in between the eyes, kind of right above like your eyebrow area. We will do the masseters, the temporalis, and then in addition to that, we will also do the occipital, kind of like the back of the head here. A lot of patients have a lot of tension right here. And then also the cervical paraspinal, and then sometimes the traps. I know what you're thinking. That probably seems like a lot, and it is a lot, but For somebody who experiences like a lot of headaches or migraines, typically the more areas or boxes that we check, the more likely it is for it to help you. Another thing to keep in mind here is when we're treating all these different areas, it's going to cost a little bit more than it would just for like some wrinkles or for just the masters for the TMJ. Because with the headaches and the migraines, we're treating so many different areas, we kind of inherently are giving more units of Botox, which then increases the cost. And so these types of injections can start to kind of add up a little bit just because we're treating so many different sites. One thing to keep in mind too is if you can kind of pinpoint exactly where you feel like your headaches are originating from, then you could always try targeting specific areas to see if that gets you relief. Don't feel like you have to go all in and treat all of these sites or it's not going to work. And of course, before you start Botox for this type of therapy and treatment, you always want to like fill out a detailed questionnaire so that then over time, you can really monitor and see how you're improving on paper to make sure that it is in fact working for you. A third way we can use it, the Gummy Smile. So some patients, when they smile, their upper lip may just move a little bit too much. It's almost hypermobile. And so what we do is for a patient who smiles and then shows more tooth or more gum than they're wanting to, we can actually inject Botox right here and right here, kind of just lateral to the nose. And what that'll do is it will relax that muscle that pulls up on the lip so that then when the patient smiles, they don't necessarily display as much tooth or gum as they typically do. Now, we've done this for a lot of patients at the office and it seems to really work very well. Of course, everybody's going to vary as far as the amount that you want to inject and how much we're actually trying to lower the lip. So it'll vary between individuals, but it is an option for you if you're somebody who maybe is self-conscious about that. The lip flip and wrinkles around the mouth, aka perioral wrinkles. Now, I haven't really treated the wrinkles around the mouth with Botox, but I do the lip flip with Botox. Now, this one is it's pretty easy. What we would do is we inject the Botox right here, kind of at your Cupid's bow, almost the philtrum of the lip, and then a little bit out here laterally to just kind of give the lip a more plump looking appearance by like almost curving it outwards. Personally, I think this one seems to be the most uncomfortable just because it's on the lips, and like if you get a blemish on your lip, you guys know how uncomfortable that is. So in my experience, patients really get great results with it and are very happy with it. So some Botox FAQs I'm going to go through here really quick. There are of course certain medical conditions, medications, or other reasons not to get Botox. So step number one is to always consult and provider if you are in fact a candidate, all the different pros and cons, and then the risks and complications involved with the procedure. Number two, so the time frame of the Botox. So after 1 to 2 days, you'll start to notice maybe some of the effects of it. After about a week, it'll hit its kind of peak effect. And then typically at about month 3, maybe 4, it'll start to kind of wear off and decline a little bit. Now, in my experience, usually at around 2 months, that's really when you start to notice it taper off. This, of course, will vary depending on each individual person and, of course, the site or the area that we're treating. I've had people ask me about complications such as a droopy eyebrow, droopy eyelid, asymmetric smile, things like that. So with this, it's really important that you work with a skilled and trained injector. So there are certain landmarks, certain areas, regions that we want to stay within and avoid to basically limit the risk or avoid any complications such as everything that we just described earlier. So work with a skilled injector who has all the advanced training. So what about other brands or names? A lot of the brand names that you will see are in fact Botox, Botox Cosmetic, Dysport, Xeomin. Essentially all of these things are going to do the same thing. They do have like subtle little differences as far as like kind of what makes them unique. And of course, what they are actually FDA approved to treat. So there are different ones out there. In this video, we just kind of used the term Botox to describe all of them in general. What about long-term use? I'm sure there will be more studies that come out on this over time. But one of the things that they discuss is that the more that you do it over time, the effects of it may last even longer. So essentially, the longer period of time that you've been doing Botox, you might notice the effects of it lasting longer than 3 to 4 months. And so you might actually over time need to get it even less. There are some studies that show that the long-term or repeated use of it can in fact cause the weakening of some of the muscles involved that we're treating. But I'm not aware of any studies that actually show any long-term permanent muscle atrophy from the Botox. Any questions or comments, please leave them below. As always, thank you guys for your time.